Well, good afternoon and welcome to Tomah Health and Wellness Campus, home of Tomah Health and Gundersen Tomah Clinic. I'm Eric Price, Marketing and Public Relations Director at Tomah Health. We truly appreciate your attendance today as we officially unveil the two new facilities, thereby enhancing quality health care in the Tomah area. To kick off our program today, here's Tomah Health Chief Executive Officer, Phil Stewart.
Thank you, Eric. I'd like to thank you all for coming out, and hopefully the weather holds for us before we get inside. Just very quickly, I mentioned that this project actually started 10 years ago with planning and discussions and what we wanted to do. In the last 2 years, we've been under construction, and what you see today is the culmination of all of that planning and effort. It could not have happened without all of the staff from our hospital and with the staff from the Gundersen Clinic, so we appreciate everything that they have done to make this happen. Healthcare in the community isn't just the hospital, it is the clinic, and this community is blessed with two very fine clinics, the Mayo Health System, which we collaborate with on a very regular basis, and now with Gundersen connected to us, the ability for us to provide state-of-the-art care right here in Tomah has just gone up exponentially, and I think that's a real boost not only for Tomah but for all of Monroe County. So we're very appreciative of all of this. Hope you enjoy the tour, and we'll see you inside.
Thank you, Phil. A strong organization depends on leadership from a dedicated board of directors. Welcome Tomah Health Board President Oakley Moser.
Thank you, Eric. Good afternoon, everybody. On behalf of the Tomah Health Board of Directors, I'd like to just take a moment to recognize and thank the many stakeholder groups that were involved in this milestone Tomah Health Campus project. First off, thank you to Gundersen Health System for joining us on our new campus here. Congratulations on completion of your new clinic and successful start of operations. I can tell you that your expanded services on a personal note are already helping people in this community, so appreciate that. BWBR did an excellent job as our design contractor for the project. Not sure if many of you are aware of that. And certainly Markin & Johnson was our building contractor. And as they have many times for Tomah Memorial Hospital, have helped us complete the project on time and on budget with great workmanship. So thank you, Markin & Johnson. The Ancura Consulting Group actually served as Tomah Memorial Hospital's owner's rep during the 2 years of construction, and we appreciate their work as well. The United States Department of Agricultural's Rural Development Arm, I believe, is represented here today and is providing us with a significant portion of the borrowed funds that we have for the project. So we appreciate their commitment to us as well. Certainly would like to thank our local city officials. We greatly appreciate their partnership, their infrastructure investment, and their collaboration the entire time this project is from design stage to completion that we have now. The board would greatly appreciate, and we very much want to thank the generosity of the Tomah Memorial Foundation and the many local donors who stepped up once again, providing monetary donations, material donations, and consultative services. As is often the case in our city of Tomah, they're the same people and organizations who promote many community-oriented initiatives, and they truly care and are willing to invest in the quality of life. We're also very grateful to many individuals over the last 20 to 25 years. I know Phil mentioned 10 years maybe in the design and conceptual stage, but it probably goes back 20 to 25 years. The many people who served on the board prior to myself and the current board members, the many management team people at Tomah Memorial Hospital over that same time period, and the many medical providers during that period who have served our community in one way, shape, or form with Tomah Memorial Hospital. It is all these folks over the last 20 years through their strategic planning, their fiscal responsibility, and their effective and efficient operations that made this landmark project and expansion of services not only a dream but a reality that will culminate here on October 2nd. Certainly we would not be here if not for the citizens of Tomah and throughout our service area who have placed their trust and actually their health and wellness in the very capable hands of our staff and team of providers. We recognize that you are the reason for our mission. I can tell you the last 2 years have been very challenging for the current Tomah Memorial Hospital team with planning, designing, training, and preparation for eventual opening here on October 2nd, all the while maintaining operations and services at the current hospital location on Butts Avenue. It's been a Herculean task, and as a board, I can tell you that we're extremely delighted in their results, grateful for their commitment exemplified every day, and excited about the future in the new Tomah Health facility. I speak for all the board of directors in thanking all of the stakeholders and tell you that we are privileged to be a part of the Tomah Health team. And with you, we remain committed to our mission of providing superior health care services to those who are sick and injured and offering services that support a healthy life. Thank you very much.
Thank you, Oak. As he inferred, operating independently healthcare facilities, we're delighted that the Gundersen Health System is also located on our campus. Please welcome Gundersen Medical Chief Operating Officer, Dr. Michael Dolan.
Thank you, Eric. Wow, what an impressive medical campus we have here in Tomah. You just don't see this around the rural areas of Wisconsin or anywhere else in the country, so this is impressive. First, I want to just pass along that Dr. Rathgeber is really disappointed that he cannot be here today. Like many of us with aging parents, his role as a son superseded his role as a CEO for today. So he sends his regrets, but his appreciation to everyone that played a role in making this dream happen. On behalf of Gundersen Health System, I would like to thank Mr. Phil Stewart and his staff at Tomah Health for their collaboration to make this day possible. Without Phil's hard work and the insight of his team, we would not be here celebrating this today. Thank you. We look forward to being neighbors with you when your facility opens in just a short few weeks and you move in. Gundersen and Tomah Health share many similar visions of keeping quality health care close to home for both the patients and the communities that we serve. This campus ensures that area residents will have access to the healthcare services that they need for generations to come. A good example of this is Gundersen's new comprehensive cancer center right next door. Adding this very important service right here in Tomah allows us to deliver specialized care to patients who have cancer where they need it most, when they need it, and reduces drive time and additional costs for patients and family members to improve their experience of care. A special thanks to Kathy Jo Koblenz and her clinicians and staff at the Gundersen Tomah Clinic for their dedication to our patients and the extra time they have taken to make sure that we have had a smooth transition to our new clinic next door. Thank you for celebrating with us today, and I hope that you have an opportunity to go inside and see what we have available and what Tomah Health is going to be able to provide in just a short few weeks. Thanks for coming.
Thank you, Michael. Healthcare professionals, as you can imagine, are key ingredients to providing quality healthcare. Please welcome Gundersen Tomah Clinic Medical Director, Dr. Robert Holness.
Nice and close.
I know, right? Good afternoon, everybody. This has been an exciting 18 months for us, from the initial planning of our new clinic leading into the construction and now moving in. We have been seeing patients for the past 3 weeks, I think, from August 26th, with great reviews and some welcomed feedback. The building is huge. We've moved from probably roughly 33,000 to now approximately 78,000 square feet. The site brings all of our services to one location. We include family medicine, specialty services to include outreach, behavioral health, vision, and of course our comprehensive cancer center. One of the most exciting additions, though, is our new pharmacy. Patients can actually have their visit with their provider and then actually pick up their prescription and head home or wherever else they need to be. The new clinic represents Gundersen's continued support for communities like Tomah and surrounding areas, bringing care close to home and with love and medicine, and partnering with excellent hospitals like Tomah Health. I want to especially say thanks to our valued patients for entrusting the care of yourself as well as your families to us. Enjoy your tour and enjoy the rest of the day. Thank you.
And finally, as part of the Tomah Health financing of this project, a $66 million project just doesn't happen. Thanks to support from the United States Department of Agriculture, Tomah Health received the largest USDA rural development loan that's ever been awarded in the state of Wisconsin. Please welcome USDA Rural Development Area Director, Kelly Eller.
Thank you. So I am with USDA Rural Development out of Menominee, Wisconsin. And on behalf of our State Director, Frank Frassetto, I am honored to be here today to celebrate the Tomah Memorial Hospital grand opening. Under the leadership of the administration and USDA Secretary Sonny Perdue, Rural Development's vision is to bring economic development and rural prosperity to our wonderful state. We are committed to rural America by creating prosperity and improving the quality of life in rural America by leading USDA to be the most efficiently managed, most customer-focused department in the federal government. In order to bring economic development to our rural communities, we are focusing on 3 key priorities: infrastructure, partnerships, and innovation. Investments in rural infrastructure means more jobs and more capital and more opportunities to help entrepreneurs create or expand their business. Partnerships leverage expertise and capital, allowing us to achieve more together than we could alone. Innovation is what we do every day to ensure good management practices that use taxpayer dollars as efficiently and effectively as possible. The project encompasses all 3 of these priorities, with bringing in infrastructure to improve the quality of life for the patients that will utilize this campus, the partnerships between all key players that made this happen, and the innovative technology that will enhance the patient and technical staff experience. I want to especially thank USDA Rural Development Boots on the Ground team that carried this project through the last couple of years. Brendan Heinen, the Community Program Specialist, and Kathy Zarowski, our State Architect. Again, congratulations to Tomah Health staff, the board, Gundersen Health, and the community on the beautiful hospital campus completion.
Thank you, Kelly. At this time, thanks to our friends at the Tomah Chamber of Commerce, we're now going to ask for our official ribbon cutting. We're going to hopefully ask all the Gundersen Clinic staff to be kind of down toward the Gundersen Clinic, and we'd like all the Tomah Health staff kind of behind me, and we'll meet in the middle with our speakers this morning or afternoon to actually cut the ribbon. Following the ribbon cutting today, we'll ask area media to meet back in the main lobby for interviews. And then also tours of both Tomah Health and Gundersen Tomah Clinic will follow until 6 o'clock tonight and also be held again tomorrow from 9 a.m. until 1 p.m. Thank you again for being part of this historic healthcare day here in Tomah.
Look right here, guys.